All right, before we begin, I just want to make sure everyone that's in the meeting currently has the ability to unmute themselves.
Yes.
Yeah.
Yes.
All right. Everyone else that will be admitted after this will
Or
not.
just the people who will be speaking. Sorry, Alex, did you mean for everyone or just the speaker?
Just the ones that are speaking. So if you're an interpreter, I don't think we'll need to communicate directly through Zoom, but if you do have questions or issues, I think, Anne-Marie, did you share with them your phone number or you could also private message?
It sounds like it would be helpful for everyone to unmute themselves, actually.
Okay, so you want that ability for everyone so far here?
Yes, thank you.
So let's go ahead, and everyone that's in here, I think I should have already had the ability turned off for you so that you can. So why don't you try and do that now? No? Anne-Marie, you can't unmute yourself?
Now I can.
Go ahead and
Thank
try
you.
and unmute yourself, Anne-Marie, and then unmute yourself again. See if you have.
Okay.
No?
I think you'd have to make her a co-host to go on and off mute.
Yeah, I'm turning that on for everyone now. That's not a co-host yet. So Anne-Marie, you're a co-host. You should now be able to unmute yourself.
Okay. Thank you for making me a co-host. I don't know that I'll need it, but it's nice to have it just in case. And for the interpreters, you can message me privately, and if you don't have it already, I'll send you my cell phone number so you can text me.
Thank you. And I actually can unmute myself now if we need to.
Perfect.
Great. So I think we're ready to admit everyone.
Yeah. You want me to do that for you, Janine?
Yes, thanks, Alex. Hello, everyone. Welcome to the Wellness Crisis Call Center and Response, the very first community stakeholder work group. We're happy you could join us this afternoon and really appreciate you choosing to spend your time with us. I'm Janine Spotnitz. I'm a program planner with Department of Health Services, and I'm joined by, from Behavioral Health Services, the director, Ryan Quist, and Consumer Advocate Liaison, Angelina Woodbury, as well as from Public Health Advocates, Program Manager, Ryan McClinton. Before we get started, I want to go over a couple housekeeping items. To begin with, we have a lot of information to share, so today's meeting will be in a webinar format, which means that everyone is muted, so no one's speaking verbally, but feel free to input in the chat, which is open to all. And we encourage you to drop questions as they come up throughout the meeting. And we're certain that we can't get to them all today, but we will review them and have time at the end, hopefully, to address some and plan to address the others in future meetings. I'd also like to note that this meeting is being recorded and it will be available for people who weren't able to attend tonight. And as I mentioned earlier, this is the first of a series of community stakeholder work group meetings. And this first meeting is for level setting to ensure that we all are working from the same information, and that will be a foundation for our work in future meetings, which will be interactive and have breakout groups and time to speak and discussion. So this is just the first level setting meeting, and the future meetings will be interactive and involve all of you. So thank you for joining. You'll notice we have ASL interpretation and real-time captioning available. If you need support to accessing either of those, then please type it in the chat and direct it to Anne-Marie Rucker, who can assist you as needed. And we also heard access needs from participants include ensuring that we verbally describe all of the PowerPoint content for our participants who are blind. So we will be mindful of definitely everything aloud, as well as speaking slowly enough for our interpreters. Now I will review our agenda for today. We will have introductory remarks from Dr. Quist, and then I'll give an overview of the process. So our journey thus far, where have we been as far as community engagement, and what is the process for moving forward? Then we will have Ryan and Angelina share the community input that we've received thus far. And some of you may have been familiar with that from reiteration for you. And for those of you who this is new, we're glad to be diving in together. And then we will share the proposal that Behavioral Health Services will be sharing at the upcoming budget hearings at the Board of Supervisors meeting this week. After that, we will review how this work intersects with other efforts, including at the city, county, and state level. And then finally, we'll recap our next steps and have time for some Q&A. Now with that, I'd like to pass it off to Director Ryan Quist for introductory remarks.
All right, good afternoon, everyone. Thanks for being here. We really appreciate your time, and want to thank you for dedicating some of that time to join us in this conversation. And of course, this is, Janine said, this is a level setting session, and then we anticipate that we'll be having some opportunities for feedback in future sessions. So really appreciate your time here. So just as a reminder about how we got here, fall, Supervisor Kennedy proposed the idea of a behavioral health mobile response. And very exciting sort of a prospect. We held 2 community feedback sessions at the end of October, the beginning of December. It's right around the beginning of the month there, that 568 individuals participated in the conversation. And Janine is going to, I can't remember who, maybe it was Angelina and Ryan McClinton, but as a part of today's agenda, we will review that feedback in more detail. But as a part of that conversation, community members were asked to provide feedback on a number of specific topics, including the goals of the program, types of response, and the response team composition, among other topics. And that information was extremely valuable for helping us think about this project. Since then, there have been a couple of board presentations and hearings since then. So the conversation has continued, and we've continued to listen to the feedback that was provided as a part of the public comment section of those presentations. And then as a part of our budget hearings beginning tomorrow morning, there's a budget proposal for consideration by the board. And our Director of Health Services, Siobhan Katari, is going to be giving a presentation to the Board of Supervisors. So we're trying not to be too duplicative with the content that we're discussing today or with the presentation tomorrow, rather full conversation about where we're at. I think for today, we're focusing on level setting to inform our future conversations in terms of receiving feedback, more feedback from the community. The budget proposal that's being considered by the board tomorrow, we used the feedback from we used all the feedback that we've received. We've received feedback through the sessions at the end of October, beginning of November. We've heard the public comment through the course of the board hearings. We've also received correspondence from a number of folks within the community. And all of this sort of informed where we were going with basically just for tomorrow is simply a budget proposal. this budget proposal was influenced by the feedback that the community is recommending that we have a 24/7 response model, and that teams are comprised of clinicians and peers. Those were pretty much the only bits of information that we, really focused on in terms of designing this budget. And now that a budget proposal appears to be nearing approval tomorrow, hopefully, we'll see, do want to flag that it does still require the board approval. So we'll still see how that conversation happens tomorrow. But now that it appears to be nearing approval, we want to hear more from the community regarding feedback on the program design. I would like to acknowledge that individuals from many different perspectives have expressed interest in having these program design conversations sooner. And that was something that we definitely value the community feedback on designing our programs. So we did want to have those conversations, and that's what we're starting to do again today. But for the purposes of getting the feedback, I thought it was important to first focus on actually securing a budget for the program before we engaged in more feedback from the community. So that's why we sort of staged it in this order. In past conversations and presentations to the board, we have mentioned that we did talk with a consultant to help inform developing this budget. There have been concerns expressed from community members that were worried that the consultants were going to design the program instead of being designed by our own community. And that has not been our intention. It's important. It's very important that the program is designed locally to meet our needs here in Sacramento County. So that's, again, why we're having these conversations today. The main point in engaging with the consultant was to get estimates regarding volume of calls to expect. Basically, didn't know how many response teams we might need. We didn't know how much call volume we might expect. And the consultant that we worked with is known as, developed a crisis now model. SAMHSA is the Substance Abuse Mental Health Services Administration, which is a federal agency. And they sponsored and endorsed this project that basically studied jurisdictions across the country to identify where behavioral health crisis was being done well. And based on that study, they developed best practice models. Based on the information from these other jurisdictions, they were able to model what sort of call volume expectations we could expect, and also model the number of mobile response teams that would be needed here in Sacramento County. So this information was used to inform the budget that's being presented tomorrow. And now it's time to have more conversations around the design of the program. Finally, I'd like to also acknowledge that the community feedback has been very clear that this program should be separate from law enforcement. We would like to acknowledge that the community has asked for a crisis response option that does not involve law enforcement, and that the issues underlying this are complex, and that some people's experiences with different parts of our response system have not always felt trauma-informed. We wholeheartedly believe in a no wrong door approach to accessing care and want to give multiple pathways for entry into care for folks who require our services. Our intent is to work with law enforcement partners to help ensure that no matter what door people come through to receive their services, that there is the appropriate level of response, which is both trauma-informed and recovery-oriented. There's also some frequently asked questions that I'd like to address. First one being, we already have within our community our mobile crisis support teams. These are the ride-along model where clinicians go out with law enforcement. We are not proposing to eliminate those programs, but this program is going to be separate and distinct. This is a program that will be comprised of only clinicians and peers that will do the mobile response. There's also a frequent question that comes up. why the budget that's being proposed for tomorrow includes county staff in the proposal rather than going out for contractors. The basic thought process was that these teams are these new folks that are going to be doing this work are going to be responsible for managing county resources in terms of referring individuals into county funded to, rather than having a contractor manage county resources, that it would be county staff that would be managing these county resources. One last topic that we've received feedback on in the past is a concern regarding how many county staff participate in these public sessions, these public stakeholder sessions. The intention is not that are necessarily here to control the conversation or to overwhelm the conversation. The intention here is for county staff to be informed and knowledgeable about the feedback that the community is providing, and let them hear firsthand what the community feedback is on the topics that are being discussed. So they are very interested in also meeting the needs of our community as it's communicated by these stakeholder processes, and would like to hear that feedback directly. And so that's why our county staff are here participating, listening in on these conversations. So once again, I'd like to thank you all for taking your time to be a part of these conversations. And I really appreciate it. I know there's lots of other ways that you could be using your time, and appreciate your commitment to this important conversation. So thank you very much. Back to you, Janine.
Thank you, Ryan. Now I'd like to share an overview of our journey thus far. I think Ryan already addressed many aspects, but for those of you who are visual, we'll provide a timeline. But before we do that, I want to start with our first poll question to gauge your familiarity with the work thus far. So we're calling the Crisis Call Center and Response Team. Formerly, this was called Alternatives to 911 for Mental Health and Quality of Life Work. So you should see a poll question pop up on your screen, just asking if you're familiar with that, and you can select yes, no, or not sure. Let's see, about half of people have voted so far. Give folks some more time here. See a couple more responses trickling in. We have about 15 more seconds if you haven't yet responded. Okay, and with that, we will end the poll. So we had nearly everyone respond, and it looks like most people, so nearly 3/4 of people, are familiar with this work, which is great. And then for those of you who are not yet familiar or not sure, we're so glad you joined us today, and hope that we're able to clarify everything. And again, please feel free to drop any questions as they come up in the chat. So to give this visual timeline overview of our process, as Ryan noted, we held last fall 2 community listening sessions in October and November, and we also had a survey for people who didn't participate in the listening sessions to be able to provide input. And Angelina and Ryan will be sharing all of the input that we received later today. After that, in spring of this year, we had 2 presentations to the Board of Supervisors that both presented the community input that we received, as well as some iterations of proposals, which have been refined into what will be going to the board and what we'll be discussing with you all today. And then last month, the mental health board meeting, mental health board members discussed the governance structure or community advisory structure, if you will, for this work. And I'll be describing shortly where they landed and the next steps given that. So what you see here is a Venn diagram that shows the community advisory objectives. And what we have here first on the left is the community stakeholder work group. That is the first meeting today. And on the right, we have a community advisory committee that will be part of the mental health board that is not yet established. So the first objective of this group, the community stakeholder work group, is to recommend the composition and charge for the community advisory committee. I know this is sort of complex, so I hope that the visual clarifies this concept that the community stakeholder work group, so in future meetings, this group will be making recommendations for who should be on the community advisory committee, what sort of experience do we want to make sure is represented, and the charge. So really refining what their responsibilities should be of that body. And then the second objective, so that's the first objective. The second objective that you'll see in the middle of this Venn diagram, because it's shared by both of these groups, is to inform the program design. As Ryan mentioned, this is, we've heard some from community and that has been incorporated into the proposal to date. And we want to hear more to inform the details of the program and its implementation, including partnerships and marketing and so on. And then the third objective that will be just the responsibility of the Community Advisory Committee is ongoing oversight of program implementation. So that will be from program launch to ongoing in the future to ensure that there is that ongoing communication and review of how things are going and input as needed to inform implementation. So I'll pause and see if there's any questions in the chat about this. I'm not seeing any now. Then I will move on to talk about the process here. So we have the community stakeholder work group, this body that will develop recommendations around the 2 areas that I just described. And then those recommendations will go to the mental health board, who will review and finalize. And that's for the governance recommendations around the composition of that community advisory body. And because that will involve a change in the mental health board's bylaws, those recommendations will ultimately be going to the Board of Supervisors to vote on. And I'm seeing a question here. Will the mental health board have to approve the recommendation of the Community Advisory Committee before they can be advanced? That's a good question. And I don't know if that has been determined yet. I think that will probably be something that the community stakeholder work group will review and provide input on the structure for that decision making. Great question, thank you.
The one thing I'll add is that the feedback that we receive will be documented and will be included as materials throughout. So please know that your voices as a part of this process will be shared with whoever we need to share it with. So the voices will be, and the perspectives will be documented well.
Okay, and then also I'm seeing a question around where SEPTI is, and just want to clarify that we are meaning to use the umbrella term behavioral health to include both mental health as well as substance use prevention and treatment. So we absolutely recognize the importance of addressing both of these throughout all aspects of the response, and they will both be, there will be representation from both, we anticipate, and both are important parts for this work to be successful. Thank you for that question. Now, another process piece I wanted to clarify for this community stakeholder work group is in regards to participation and voting. So everyone who joins these meetings will be able to participate and provide input during breakout groups. So that'll be similar to the previous community listening sessions that we heard, where we had hundreds of people joining and we had breakout groups and facilitated conversation, and everyone was a part of that. A small subset of people will be voting members, and they will vote on the recommendations to the mental health board. So that will be reflecting on all of the feedback gathered throughout the meeting and developing recommendations from that. And that is a smaller group in order for there to be a manageable decision-making process. We're looking at probably a max of 25 people, and we'll ensure that there's a diverse representation to reflect our community. After this meeting, we will share a statement of interest form. And if you are interested in serving as a voting member on this community stakeholder work group, then we invite you to complete it. And then the planning committee will review and select the voting members and to announce at the next meeting. And then a similar note for the Mental Health Board Community Advisory Committee is the intent for this committee is for community members to be added as voting members. And as I noted previously, that the process for this involves an amendment to the bylaws, so that requires action from the Board of Supervisors. As part of this, there's a possibility that the membership of the Mental Health Board, so that's the overall Mental Health Board, not just the Community Advisory Committee, that membership could be expanded as well. Now for the process moving ahead, we have the Board of Supervisors budget hearings, and those begin tomorrow through the end of the week. So the board will be reviewing the budget proposal. We'll be describing some of the details of that later today. And then the community stakeholder work group will continue to meet. So this is the first meeting here in June, and we'll continue to meet. You see this TBD for several meetings this year. That schedule will be determined after the board hearing. So this is all presuming that this proposal is approved. And then later, and we anticipate later in the year that then the Mental Health Board Community Advisory Committee would launch. And at that point, the community stakeholder group would no longer meet. The responsibilities would shift to the Community Advisory Committee. Okay, so I hope that that was clear as far as the process, the journey to date, and then what lies ahead for this work. Now I would like to pass it to Ryan Clinton and Angelina Woodbury to review the community input that we've heard in the community listening session so far. But before I do that, I just want to ask if you have participated previously in a community input session. So if you either joined one of the 2 meetings last fall to provide your input, or if you completed the survey to provide your input. And you should see the question on your screen, and we'll give folks a minute to complete that. Okay, I see we have about 3/4 of people have completed it. Give folks a few more seconds if anyone else wants to respond. Okay, thank you everyone who responded. Let's see our results here. Okay, great. So it looks like similar to the last poll, we have over half of folks participated in the listening sessions. So thank you again for sharing your very thoughtful input with us, and hopefully you'll see your comments and perspectives reflected in what we share. And then for those who haven't, we are glad you're a part of this process, and we'll look forward to incorporating your input in future meetings. Okay, now I will pass it off to Angelina to share the
Janine,
overview.
Before you
Yes.
do, can we acknowledge some of the questions in the chat really quick?
Oh, yes, yes. Go ahead.
So there was one question regarding whether or not the genesis of the current initiative is to fund the police movement. For us in behavioral health in the county, the genesis was when our Board of Supervisors asked us to go forth and begin to develop a proposal. Whether or not that was a factor in the board's decision-making, I do not have insight into their thought processes and would not feel comfortable saying one way or another whether or not that was part of what their decision-making was. So for us as a county agency, it's our Board of Supervisors authority that asked us to move forward with developing this type of a proposal. And then we do want a substance use prevention and treatment perspective as a part of designing this program. So I want to be very clear about that is one of the perspectives that we would like at the table.
Thank you for that. And please feel free to continue to interject and respond to questions in the chat. I'm not able to monitor everything when I'm speaking. And then Angelina, pass it off to you.
Yeah, hi everybody. Okay, so as mentioned, there were 2 virtual community listening sessions that were held on October 29th and November 4th of last year. We also offered a community input survey to accommodate people who were unable to attend those virtual sessions, and an online survey went out as well. And these were the questions that were asked. What do you think the goals for a mental health and quality of life response should be? What types of crisis situations would you want this team to respond to? How would you like to access this response? What do people experiencing these types of crises need? What qualities and skills are important for the response team to have? Who should be on the response team? We also asked, what services should the response team be able to provide? And finally, what type of follow-up support would you like to see? want to thank you again for everyone that participated. Appreciative. And as you can see, we had 568 participants participated in the listening session event or the community input survey. Of those, 84% responded, so that's about 475 people, provided information about their background. So participants' backgrounds related to mental health and homelessness were as follows. 57% were friends and family members of someone who has experienced a mental health crisis. 28% were friends or family members of someone who has experienced homelessness. 25% of people who have experienced a mental health crisis responded. 20% behavioral health providers, staff responded, and 3% of the respondents were people who have experienced homelessness. So the goals. So the goals for the mental health, there's 5 of them all together. The first one, safety, de-escalate crisis. This includes ensuring physical and emotional safety by de-escalating and stabilizing the crisis with compassion and without the presence of weapons. It also includes efforts to maintain a safe environment and conduct safety planning. In addition, some participants mentioned providing resources to family members, the needs of the individuals in crisis. The second one was to provide linkage to accessible and affordable mental health resources to decrease repeat crisis and emergency department visits. This would include assessing individuals' needs and circumstances that led to the crisis, then supporting them in accessing ongoing, affordable care for mental health and/or substance use challenges. It includes providing case management services and for following up as needed. And the third one here is offer a response team that does not include law enforcement staffing. Participants described a variety of crises, including some personal experiences featured in the report for which a law enforcement response was not warranted or well suited. They suggested an unarmed mental health response team that is separate from law enforcement to respond to mental health and quality of life crises. Our fourth one was to ensure the model is community-based. This refers to staffing the response team with community-based organizations and connecting, including mental health care. Some participants specifically referenced existing community-based organizations that are currently addressing these crises, particularly Mental Health First. Some participants also recommended that a community advisory board be established to provide ongoing support, design, and implementation of the response. And the fifth one, to decrease criminalization of mental health and homelessness. This refers to diverting people experiencing mental health and quality of life issues from police consideration. And we do have a participant that quoted something that we thought was really profound: respect and kindness from a responder with primary experience in mental health, not a first responder with primary experience in people would prefer. And so we also talked about some ideas for the types of crises the response should address. These include mental health or psychiatric situations, substance use situations, domestic violence and sexual assault, people experiencing homelessness, and other crises, for example, welfare checks, child and vulnerable people protection, elder abuse, etc. And with that, I believe Ryan is taking it from here. Mr. McClinton.
Thank you, Angelina. As we look at the requested access to the response team, most participants expressed a need for a new 3-digit emergency phone number that is independent from 911 to dispatch the mental health and quality of life response. Some participants also noted that it would be helpful to also utilize a no wrong door approach so people are able to access mental health and quality of life response teams through existing service phone numbers such as 211, 311, and 911. Some participants advised that the access line should include language interpretation. Several participants noted that they would also like access via website and that it would be helpful to publicize a new number through a communication campaign. The suggested response team composition. The majority of participants recommended that the following composition for a multidisciplinary response team. One being mental health clinicians with psychiatric experience or expertise to assess mental health, access mental health records, and connect individuals to providers within the system of care. Two being peers with lived experience who can build a rapport and support the individual experiencing crisis. Three being social workers who are knowledgeable about community resources and can conduct warm handoffs, case management, and support access to benefits and housing. Fourth being medical clinicians who can conduct medical assessments as well as for emergency psychiatric medications with doctor's orders. Some participants noted a clinical health background helps assess mental health issues that may accompany or underlying mental health crises. One of the key comments that we captured in that session from one of the participants is that it's incredibly important that the people who show up to these calls look like normal people and talk like normal people. Having that peer support experience is important. And this really comes out of something that I think is being highlighted that's very important in the chat about the call for these types of services as a result of the traumas that communities experience from police violence, and why we want to make sure that we have folks that are casually dressed in plain clothes and also connect with people on a volunteer basis and then a natural human connection basis. The requested response team skills and expertise that folks are asking for listed as de-escalation, which this refers to the ability to keep people calm and safe without the use of force. They want to see some of the skills being trauma-informed. Participants described this as being compassionate, listening without judgment, validating feelings, and respecting the individual's choice and control. This skill helps to stabilize a crisis situation while avoiding potential triggers and minimizing additional traumas. Some people also mentioned the need to be aware of different types of traumas, for example, complex traumas, historical and intergenerational traumas, and how they affect the mental health crisis. They like to see a background in behavioral health. This more so refers to a knowledge, experience, and training in mental health and substance use to recognize symptoms to assess their severity and provide people the appropriate response. Lastly, most important, a response to race, culture, and gender, and disability. This includes multicultural and multilingual response teams that understand implicit bias and are able to respond to specific needs related to race, culture, and gender with humility. Some participants also described the importance of ensuring a response team that is equipped to identify and meet the needs of specific populations, including peoples with disabilities, be it intellectual and developmental disabilities, youth, and other older adults. Some more feedback that came out of that session from some of the participants were that they want someone who is calm, approachable, knowledgeable about mental health crisis, and empathetic. I worked in one of the most intensive outpatient settings in Sac County and de-escalated everything under the sun with no harm done. Again, speaking more to that trauma that many of our community members have lifted up at the Board of Supervisors, as well as many of our community stakeholder groups, collecting feedback on why a program like this is necessary. Some of the requested crisis services that were lifted up, participants most frequently described services that include housing and shelter suitable for an individual's needs and utilizing a housing first approach. Mental health and assessment / evaluation, and services that individuals may be referred to after an evaluation. Some people describe the importance of transportation assistance and peer accompaniment to mental health and substance use treatment services. Other survival needs. This includes providing a meal, water, and other items needed for survival to respond to the individual experiencing crisis. Medical care and medication. This includes immediate medical services for urgent needs, connection to ongoing physical health care, and assisting accessing medication. Also, and last but not least, crisis stabilization and respite centers. This includes 24/7 drop-in centers where people can access mental health care and safely while intoxicated or under the influence of substances. Another comment that was captured during this part of the discussion from participant: we need more affordable housing, employment training programs, and a robust mental health and substance abuse program. And services available is what leads to issues needing alternatives to calls for 911. Some of the suggested follow-up supports that were lifted up, the majority of participants indicated that ongoing follow-up and case management is needed to ensure individuals are connected to support networks and services, and to prevent mental health and quality of life crises from occurring. Many participants also recommended providing transportation and financial assistance to help individuals access needed services, as well as other specific types of follow-up that participants described would include rebuilding social support systems and including family and loved ones in a follow-up plan, wraparound services, needs assessments for people experiencing homelessness, and job support services. And with that, I believe I'm going to turn it back over to Janine.
Thank you, Ryan. Now I will be sharing the Behavioral Health Services proposal for the Board of Supervisors budget hearings, which begin tomorrow and go through the end of the week. And these are all based on the public board documents, which you can find at the Board of Supervisors website. You'll see here the Wellness Crisis Call Center and Response proposal includes the following budget. So the total is 9.9 million in actual expenditures. You will also see a 12 million figure, which is because of some double accounting of some funds. I know that's confusing, apologies for that. The actual expenditure cost is 9.9 million. And the breakdown of that is 6.4 million in net county cost. That's our general fund. 2.1 million in Mental Health Services Act, MHSA funds, and 1.4 million in federal financial participation. Now, this growth being requested includes staff and facilities. And I want to reiterate that the details for the program implementation have not yet been determined, and that will be informed by this community stakeholder mental health board community advisory committee. So as Ryan Quist described, the proposal is for a separate non-law enforcement number and call center. The call center and response are 24/7. And it also includes an expansion of the mental health urgent care clinic to 24/7. And that responds to some of the community recommendations that Ryan Clinton was just describing.
I'm going to jump in here, Janine, really quick and clarify that the general funds are going to be for the call center and for the mobile response, for the 24/7 mobile response and 24/7 call center. The only place where we are proposing to use the MHSA funds is for our mental health urgent care clinic, which is already an MHSA funded program as an innovation program. And we have leftover additional approved funds as a part of the state approval process for innovation plans that would be eligible to be used for the already approved urgent care clinic MHSA project. So we're not proposing to use the MHSA funds for the mobile response or for the crisis call center.
Thank you for clarifying that. Then to share some of the details around the staffing and facilities, the budget includes 55 full-time employees, 5 vehicles, and appropriations, also known as funding, for cost of lease for a facility, for marketing, and for necessary equipment. Oops. The staffing of the mental health or behavioral health response teams includes senior mental health counselors and behavioral health peer specialists. And I'll iterate again that this reflects the community input and what we heard for mental health clinicians and social workers and peers. And then the geographic scope of this proposal is throughout the county except in the city of Sacramento. And the city, through their Office of Community Response, is doing their exciting work in this arena and developing a response. And the intent is for our teams to work cohesively, and we'll be figuring out what that looks like. Now for the proposed services that will be provided through the Wellness Call Center response. And again, we listened, and this is based on the feedback we heard from previous community input meetings. And this is where we're at, and we are absolutely open and welcome additional feedback on this. And this will continue to be refined based on that feedback. Okay. So we see here, services include first, triage and assess needs and risks. And that includes mental health assessments to determine the appropriate response needed. Then, of course, providing crisis intervention and de-escalation services, and that would be available both over the phone and in person, depending on the needs of the individuals. And then creating safety plans is also a key service. And the safety plans include identifying and leveraging the strengths an individual has, as well as their natural supports, and coordinating with their existing health providers. So the response team, given that they do have access to they are county staff, they have access to records. So in the event that someone has already a provider, they'll be able to their existing provider if appropriate, or if they're not already connected, then they can help to make that linkage for ongoing services. And finally, there may be referrals as appropriate to resources including mental health urgent care clinic, mobile crisis support teams, or other emergency responders if necessary. Okay, and maybe we'll pause for any clarifying questions. I'll pull up the chat, or feel free to chime in. Yeah.
In chat, I'm seeing a lot of great feedback and different ideas. I think that is precisely the type of conversations that we want to have going forward. So definitely, like, take note of those. We're taking note as well. So I'm not trying to say otherwise, but take note of those and help keep bringing the issues that you're raising to the forefront as we have our future conversations. So again, this is the first one where we're sort of doing level setting, and then we're going to have additional meetings to bring folks together to provide input on the design of this program. So definitely take note, we are as well, but take note to make sure that you bring your areas of interest to the forefront when those topics become most relevant in the conversations going forward.
Great, thank you. Okay, and I see a question of 988, and we will address that now. Perfect timing. So here we'll talk about intersection with other efforts. There's a couple areas I want to highlight at the city, county, and state levels. And this will just be the first overview, and we will do a deeper dive in future meetings as appropriate. So first, I've already described this at the city. The Department of Community Response is up and running, and collaborations are underway. So we'll be coordinating these efforts, and we'll discuss this more at a future meeting. At the county level, I wanted to highlight the Homeless Encampment Initiative, which is a partnership between Department of Health Services and Department of Human Assistance. And this is really to fund a robust street outreach, shelter, and housing connection program designed to help support people experiencing homelessness, specifically in unincorporated county, to transition to shelter and housing. It involves currently a $5.9 million budget growth request. And this will fund 2 sanctioned encampment sites, which would each serve 100 people, 3 encampment teams that each have 4 staff. And the staffing proposed would be 2 housing navigators, a mental health counselor, and a peer. And it also includes continuing approximately 25 sanitation stations that are located in unincorporated county, as well as 3 scattered site shelters with an additional 15 nightly beds and enhanced housing navigation services that would be provided by 9 full-time staff, as well as some limited term problem-solving financial assistance to support transitions to permanent housing. Then anything?
I'm going to let you keep going through this slide, but I do want to just reiterate the importance of the partnership that we're going to have with the city. And they're doing some amazing, important work, is to collaborate and not, step on each other's toes. And we're going to figure out what that looks like. We've been in conversation with the city around their work in the Department of Community Response, and we'll continue that conversation going forward. I just wanted to reinforce that, we're going to collaborate very closely with that.
Thank you. Then at the state level, there's 2 initiatives that I wanted to highlight. And one is CalAIM, which folks may or may not have heard of. It is a comprehensive Medi-Cal reform package, and is very far. There's 2 components specifically that relate to this work, and those I will just highlight, and we can definitely share more at a future meeting in more detail. But at a high level, they include adding housing navigation services for people experiencing homelessness, a potential service that managed care plans provide, as well as access to sobering centers. And so this would be essentially help to expand those services by having another funding source for Medi-Cal beneficiaries. And then 988, I see someone brought that up in the chat. We know that 988 is created by federal regulations. So that is the National Suicide Hotline Designation Act. And that designates the 3-digit 988 number as the universal number within the United States for the purpose of national suicide prevention and mental health crisis hotline systems. So we know the state has to implement this by July 16th of next year, 2022. Currently, the state legislation isn't going so well. The language ended up turning into a legislative intent placeholder bill. You can look it up and see all of the original proposed language is just crossed out. So it's more of a placeholder bill currently. And what this will look like for California is unknown. But what we do know is there's this 3-digit 988 number that will be coming. And so we absolutely anticipate this will have some impact on the call center response that we are designing here. And we will be watching this closely, and there will be more to come on this. Are there any questions, clarifying questions about any of the intersections that I've just described?
No, on those specific topics that there were. I would like to comment on the chat mention regarding the importance of collaborating and not being duplicative of our community-based organizations' works and the work that they do. I wholeheartedly agree with that. We need to, one of my mentors brought me up with the idea around the importance of community capacity building. No one of us, no one agency is ever going to be able to meet all the needs of the community component of how we need to roll out all our programming. And so I think that that is an excellent topic for our future conversations and feedback in terms of how would that look? What is the best way for us to ensure that our community-based organizations are, that we are collaborating with our community-based organizations and taking advantage of each other's resources and doing the best by our community and by the consumers that we serve. And then there was another question that I can't remember. Janine, can you talk to, there was a question, will we have time for community input today for this community meeting?
So we did not have that as part of today's agenda. So today is primarily to share information and then to answer questions, clarifying questions. And at the future meeting, we will have plans for breakout groups to be able to discuss input. But of course, if there's something top of your mind, feel free to share it in the chat. We'll save the chat and also hope that you join us for future meetings to discuss that. Then I see another question. Is it the intent of this new call center to use 988? I think that the timelines might not quite align depending on when this launches. So there might be a need for something else first before 988 is launched. Is there anything you'd like to add to that, Ryan?
I think my main comment would be there is a lot going on in this arena, state, federal, et cetera. And a lot of these initiatives we're going to have to coordinate and pull together in order to make sure we have a cohesive way of implementing these locally. What exactly that looks like, I think it's difficult to predict until they get some of the legislation and state direction gets.
Great, thank you. I see a question about how county residents can advocate for these goals within the BOS. To that, I would just say generally that all board meetings are open for public comment. And so people can provide spoken comment by calling in or written comment that gets to supervisors. Great. Then with that, we are actually moving forward. Oh, sorry, BOS is Board of Supervisors. Appreciate all of the questions to make sure that we're all on the same page. So here we wanted to reiterate the immediate next steps. So the Board of Supervisors will review and vote on the proposal that we have just described some of the details of starting tomorrow. So budget hearings are ongoing Wednesday through Friday. And then we will send a follow-up email to everyone who participated with the statement of interest form. So you can complete that if you're interested in being considered for a voting member position. And then we will also send out the date for the next community stakeholder work group meeting. And now we wanted to hear from everyone through our last poll question. How likely are you to participate in this process in future meetings moving forward? We have about 15 seconds for people who want to respond and haven't yet. Okay, great. We will end the poll and share the results. Okay, great to see 3/4 of people will definitely participate. We are very happy to have you join us for the next meeting. And the rest of you who might participate, we hope to have you again for your input. And I apologize for any misunderstanding about the intent of this meeting. And I see a request for a recap of the community stakeholder work group work and goals. So I will actually go back to those slides if it's helpful to review again. Okay, so here we see again the objectives of the community advisory group. And I know this is kind of complex, so I think it is worth repeating this slide. This body is the community stakeholder work group, and the main objective of this body is to recommend who should be on the Mental Health Board Community Advisory Committee and what their charge should be. So what should their responsibilities be and what voices, interests should be represented there. And then secondly, you see here in the middle of this Venn diagram, the community stakeholder work group will input on aspects of the program design, including partnerships. I've already seen a lot of conversation in the chat around working with different groups. And then marketing, how do we get the word out to community about this program? How do we do that effectively? What are good venues to use for that? And other aspects that the work group identifies as important. Does that help to clarify it? Feel free to ask if there's any follow-up questions in the chat. Okay. The two advisory committees. So there's what we're calling, there's really just one advisory committee that will be the ongoing advisory committee that's part of the mental health board. And if it helps to think of this community stakeholder work group as the interim process, because we want to make sure that we are engaging with community and get a head start on the program design input, as well as have a community process for recommending who should be on this mental health board community advisory committee. And that'll be the ongoing body that oversees the crisis response and call center. And then to recap, the voting will be a component of the community stakeholder work group. So everyone will provide input. and there will be a subset of people who are voting members. And then everyone, the intent is that everyone who's on the community advisory committee is a voting member. Okay, now I'm going back to the chat to see any other questions. For the outreach for today's meeting, great question. The invite was shared with everyone who has attended any previous community stakeholder meeting on this topic, as well as the Mental Health Services Act listserv, the county social media. So I think there's Twitter and the county website and maybe other social media platforms that the county shares this on. It was also posted on the website under behavioral health services, the wellness call center and response website. And then I know that through networks, people share it widely, and we encourage all of you to do so as well to get the word out for future meetings. Please share it with your networks. Okay, I see some thoughtful comments about already thinking about answering some of the questions around who should be represented and the marketing needed. And then yes, so everyone who participated in this will get an email invitation to the future community work group meetings. Okay, and then there was a request to share the website. So I'm going to, if you give me a moment, or if anyone else who's listening can drop in the website for people to be able to look and see. The website is a great resource that has the community input report. So the findings that Ryan and Angelina shared, there's a lot more detail in the community input report. If you take a look, there are tables for each of the findings with participant quotes to support all of them. So we highlighted just a few quotes in the slides, but you can actually hear in your own words, in community's own words, quotes for each of the findings that the community wanted to see. Thank you, Melissa. So the link is in the chat for you to access that community input report. And you'll see on there are the flyers for this meeting. And this is where we post all of the flyers for future meetings. So you can find those here. Okay, maybe I'll give a few more minutes in case anyone has any other questions. And then if not, we may end the meeting early and give you some more of your evening time back. Okay, I see a question. What's being presented to the board tomorrow that hasn't been shared today so far? I would say stay tuned to see. I think you've got the key details that have been shared publicly in the budget document, and then the presentation includes a back and forth with the Board of Supervisors, and there's areas they may have questions about, so there will be potentially deeper discussion on some areas. And then a question about the length, times, and dates of community stakeholder meetings. So there is a planning team with the presenter, so Ryan and Angelina and myself and some county staff who are working to plan those meetings. Okay, and then a question on what members vote for. So the voting is for the recommendations. So just to compare it to the previous community input process, previously we gathered input from all of the community members, and then the top findings are what we shared in the report. What will be different about this process, we'll have community input gathered throughout the meetings, And then the voting members will review that and will craft and vote on recommendations based on the community input. So it'll just be that translates what the community is saying to specific recommendations, and then it will involve a vote on what to recommend to the mental health board. Okay, great. Well, I'm not seeing any other questions. Oh, a couple more trickled in. Let's see here. There was the question about the date for implementation, and we don't know at this point is the answer to that. So it really depends on what we hear from the Board of Supervisors during the budget hearing and how those conversations go. And then after that, the implementation date would be determined. And then I see another question, re-explain the role of the mental health board. Yes, I know this is confusing. So I will just pull this up again briefly, and also would say that this meeting is recorded. So if it's helpful to hear it again, then feel free to rewatch the recording for that to really be clarified. I know it can take a couple of times for it to sink in, but here we have the Mental Health Board Community Advisory Committee is the ongoing oversight for this work. So they will review the recommendations from the community stakeholder work group about A and B here. And then they will be responsible for ongoing oversight as the mental health board currently does for other programs and work of the department. Okay. Great. Then follow-up question here. If the advisory committee is voting on proposals to send them, what do they do? I'm sorry, I'm not sure I'm quite understanding that question. If you could clarify that, Kelsey. Okay, what the mental health does with the, okay, so yes, there's two stages of review here. So the community stakeholder work group is reviewing community input and voting on recommendations to the mental health board. And the mental health board will review those recommendations. And for those about the committee composition, that will require board action. So they will review and vote on what they want to take to the board for the board's review and approval. And I think this slide lays that out better. Oh, thank you, Anne. She wants to know what the mental health board is. Would you like to speak to that?
You want me to? No, you're asking.
Sure.
Okay.
Thank you.
Mental health board it's actually in regulation, body of folks that advise the board of supervisors on all things mental health. This is the shortest answer. It has requirements around specific membership and there's other, but that's its main function. Did I do okay? I see a lot of mental health board members. Did I do okay?
See, yes, from Laura and Corinne, and also highlighting that there are currently openings for position on the mental health board. Excellent. Thank you, Kelly. Here we have the full version of the mental health board's responsibilities. Excellent. Well, with that, I think we're at a good stopping place. So I want to thank everyone so much for your time. And I hope that this provided a solid foundation for all the work that's happened to date so that we are well positioned for our work moving forward to craft recommendations together and to hear all of your input and recognize all of the community expertise and perspectives in the room. And we really value your time and your input and look forward to them at our next meeting. Thank you, everyone. Have a great night.